All right, hello everybody. Thanks for joining us tonight. We're happy to have you all here for this first virtual town hall meeting conversation about the DD community in the time of COVID-19. I'm happy to be here with you. I will moderate our discussion tonight as we move through. My name is Mike Murata. I'm the director of the Assistive Technology Advocacy Center at Disability Rights New Jersey. You should be hopefully seeing my little video now. We thought that you should see at least some person. Everybody else, all the other speakers will be on just audio. That way it does save us some bandwidth as we get moving. Then it makes the screen roll a little easier if we don't have all the video going. But I'll be here and I promise to focus my attention to the screen and not move around too much and not drop out of the screen. But we are here tonight to talk. I think that this will probably not be the only time this is said, but I'll use it as the first time it's going to be said. We do not know all the answers. I don't know if any of us do, but we'll try. We'll have some conversation. Hopefully people have some resources they can share. If you submitted questions prior to the session, we'll do our best to get to some of those. We'll have some questions from the chat, and we'll try to do our best to get through those as well. We will collect everything, the chat questions that were sent, that were given to us during the session, as well as the questions that were sent prior to the session. And we'll hold those for hopefully a future event, and we're working to figure out what that's gonna look like as we go. Give you a sense of who our partners are tonight on the town hall with us. So we have staff members from Disability Rights New Jersey, the New Jersey Council on Developmental Disabilities, the Boggs Center on Developmental Disabilities, and we have staff members from the Office of the Ombudsman for individuals with intellectual or developmental disabilities and their families. So those are the people that are on the call with us. What we'll do is we're going to give each organization a chance to say hello and a quick overview of what they do, and then we'll turn it over to questions. So we'll have a little bit of that kind of back and forth, and you'll get a chance to hear from each member agency that's here and represented tonight. We thought we'd keep the focus about as broad as we could. And we're going to be looking at what's working and what are your concerns with relation to children under 21 and adults over 21. That's about as broad as we can get with our topic tonight. And we thought that felt like a better way to do this than to simply talk at you for a bunch of time. We thought this might be a better way to be able to be responsive to the community as we go. Sorry, you might notice that I'm doing a lot of clicking as I go. People were waiting in the waiting room to get in, and I'm just making sure I get them all in. Like I said before, there is a chat window. If you haven't seen it yet or found it yet, if you're on a computer, put your cursor down at the bottom of the screen and a toolbar will pop up. If the button that says chat is not located on that toolbar, look under more and chat will be there. If you're on a computer and you want the keyboard command for that, it is Alt-H. We'll bring the chat up. And so we'll go that way. If you are on the phone and are not able to see the chat, which is really about the video on the computer, we do have an email address set up that I am going to monitor in between all the other things I'm monitoring. I'm going to monitor it as we go. And if I see a question pop up, I'll try to bring it into the conversation. And that email address is questions@drnj.org. So that should give you two different ways to get in to the conversation as we go. And I think with that, I will start with the first organization. I'll let the individuals from Disability Rights New Jersey take over.
Great. Thank you, Mike. I just want to make sure you can hear me.
Yep.
Well, hello, everybody. My name is Gwen Orlowski, and I'm the Executive Director of Disability Rights New Jersey. And joining me from Disability Rights New Jersey today is Michael Brower. He's our supervising attorney in our community inclusion team, and Jill Hogel, who is our managing advocate. And between the two of them, we just have a wealth of experience and expertise. So I'm thrilled they could join us tonight. Next slide. So again, welcome to this virtual town hall. Just at the beginning, I think I need to acknowledge that we're all living through what is probably for many of us, if not most of us, the most difficult time of our lives. And this is particularly true, I think, for people with disabilities and for older adults and for other individuals who are really most vulnerable to this terrible virus. And of course, for their families and the people who love them. So I wanted to just take a moment to acknowledge that. And that we really thank you for joining us tonight. And we hope that this town hall will allow us to connect and share with one another, even though we have to practice physical distancing. So thank you for that. Disability Rights New Jersey is New Jersey's designated protection and advocacy agency for all individuals with disabilities. And our mission is to advocate for and advance the human, civil, and legal rights of people with disabilities who live in New Jersey. And what is unique about Disability Rights New Jersey is that we do this through legal channels. We're lawyers and we're advocates who represent individuals and advocate for systems change through the law. And this slide gives an overview of what we do at Disability Rights New Jersey. Next slide, please, Mike. So I'm going to pass the mic, so to speak, in a moment over to Michael and Jill. But first, I just wanted to draw your attention to our contact information here, our address and phone number, and our website. We have been working remotely since early March at Disability Rights New Jersey, but we are working hard every day to learn all kinds of new law, as well as all the work we've traditionally done, and we are actively engaging and advocating on those issues right now. We also continue to represent our clients, which I think Michael is going to talk a little bit more about. So this is how you get in touch with us. It's being monitored on a daily basis, on an hourly basis. So we're here for you. And with that, I'm going to turn it over to Michael.
Thanks, Gwen. And good evening, everybody. It's really great to be here with all of you. I'm looking forward to hearing all the different topics that are on everybody's mind and hopefully sharing some information so that we all come out the other side knowing a little bit more about what's going on. I just wanted to talk for a moment before I pass it off to the next organization about DRNJ's COVID-19 specific responses. As Gwen mentioned, we are continuing our normal client and systems work. I mean, there's projects that we always work on. There's clients that we generally will represent that are in line with some of our big priorities. We're continuing to do that. In addition, though, we're also adding on another layer as we're all working remotely, staying engaged with state leaders, in particular the Department of Health, Department of Human Services, where a lot of our clients receive their services and where they depend on some of the most important responses in a time like this. We're also trying to stay in front of some of the hot issues that are coming up. A lot of those I saw that were raised in some of the pre-submitted questions. Different changes, things like adjustments to the Medicaid system, expanded flexibility for states there in providing services or maintaining services for folks, especially as that would affect somebody with disabilities. Also civil rights issues. Obviously, again, a hot topic would be things like access to health care, if there's any kind of health care rationing, staying in front of issues like discrimination or unlawful discrimination against people with disabilities. So there's some of the things that we're adding some extra time onto our schedules to keep in front of those, having those conversations in the hopes of preventing some of the bad outcomes that other states have seen already, or some of the ones that we can all probably imagine, trying to keep in front of those. So that's just a quick overview. I think I'm going to pass it on from there, Mike, to the next agency.
Sounds good. And actually, I inserted my own slide because that's what you can do when you're the facilitator.
Then it's you.
I just wanted to pop in one quick slide about the program that I am the director of at Disability Rights New Jersey. I'm the director, again, of the Richard West Assistive Technology Advocacy Center. And we are New Jersey's federally funded Assistive Technology Act project. And so what we do is make sure that people across the state individuals with disabilities and their families and their caregivers have access to and information about assistive technology. And we do that through a range of services. We do demonstrations of technology. Now, typically those are in person. Clearly that's not happening now in person, but what we are doing now is we are setting up demonstrations for people, and we're doing them remotely the same way we're doing this right now. So if someone wants to see some technology, hopefully myself and the other AT specialist, we have it with us and we can demonstrate it and show it to you. We also have an assistive tech lending center. Again, also currently not sending out equipment to people, but in times when it is running, that would be a center that is free to any individual in New Jersey to borrow assistive technology for 3 weeks at a time to try it out. We also do device reutilization. We do that with a partnership with Goodwill Home Medical Equipment, which is down in Belmar, the Camden County Belmar, not the on the ocean Belmar. And they have a warehouse of used assistive technology and durable medical equipment that they clean, sterilize, repair, and then put back out in the community for a considerably less amount of money. So they are still working. They are on a modified schedule, but they are still working. And then finally, we do training and webinars, and we're also running weekly AT town halls. So where this one is focused with the DD lens, the one we do every Monday is focused on assistive technology, and we get AT experts from around the country to participate and answer questions. And all of that is at our website, which is at4nj.org. So thanks for letting me drop my slide in. And Mercedes, I'll turn it over to you.
Okay, thanks there, Mike. Good evening, everyone. It's so good to see the names of many of you who we know and those that we don't. We're happy you joined us tonight. I would like to welcome you on behalf of the New Jersey Council on Developmental Disabilities and let you know that our volunteer council members and team of 12 staff are here to advocate, collaborate, and educate with our stakeholders during this most challenging time. Life is really different in so many ways, and we're continuously monitoring what's happening across our state and across the country for individuals with IDD and their families. We definitely value tonight's town hall to give you an opportunity to learn and to be heard. I don't think any of us could disagree that these are certainly extraordinary times, but there's also some extraordinary things happening all around us every day to keep the people that we love healthy and safe. And we certainly hope that this continues and that we'll have more positive stories to share when we come to the other side of this challenge, and we will. Next slide, Mike. Since 1971, the Council has been federally authorized to foster the leadership and advocacy skills of people with IDD as they work toward greater independence in their communities. And we also give individuals with IDD and their families a voice in the planning and implementation of public policies. And there's our friend Barb. Next slide, please. Let me take a moment to give you a brief overview of our response to COVID-19 and related issues. The Council has moved to a high-capacity telework environment, like most of us, for about 2 weeks now. We've continued to operate our People First chapters throughout the state through remote meetings with advocates, and the Regional Family Support Planning Councils continue to hold remote meetings locally and more frequent virtual meetings on a statewide basis. This is a changing environment for all of us, and we're doing the best we can to keep you current with credible resources that become available. You can locate the information that we've collected on our website. It's a pop-up on our website if you go to njcdd.org. We've also been strongly advocating for some of the measures that have already been put in place, like the hiring of parent, guardians, and spouses, and the allowance of overtime pay in the self-directed system. We've also been strongly advocating for measures like the availability of personal protective equipment for DSPs. We continue our collaboration with our federal, state, and agency partners, as well as advocates, families, and providers as best we can in these times. And we remain in frequent communication with over 15,000 subscribers, sometimes multiple times a day. Next slide, Mike. The one item that I wanted to make sure you're all aware of is the council does have a new emergency funding application that we posted late last week, and we encourage you to go to our website to review the funding announcement and a streamlined application. We've received nearly 100 requests in less than a week, and approval letters will begin to go out this week. We're able to move quickly on this funding announcement by modifying an existing contract with the ARC of New Jersey. And I'd like to take a minute to thank the ARC of New Jersey for immediately stepping up to the plate to administer this funding announcement by processing the application and funding approvals. So this funding is available for children and adults with intellectual and developmental disabilities, for families of individuals with IDD, and to the qualified providers supporting individuals with IDD, so long as those requests directly assist an individual or family. The funds need to be used to help people directly that promote health, activity, and engagement with family, friends, and peers, alleviate anxiety due to social distancing, and/or increase positive shared experiences. So you might ask, what will be funded? And basically, any activity to help the individual and family remain engaged during social distancing. Some of those examples that we've seen right up front are exercise equipment, board games, playthings, and arts and crafts. Also for items that alleviate anxiety due to social distancing, and some of those immediate things we've seen are electronics, technology, and internet access. We have seen the requests, and we've set a limit on the requests. So they range from $250 to $500 per application. And just to close, I'll say I encourage you to read the grant policy, the FAQ, and the other documents in this notice, and the budget and application forms, and they're located on njcdd.org. And again, that's a pop-up. You don't have to go look for it. Just scroll down a little bit. So again, thank you for joining our call tonight, and we're very happy to hear what you have to share. Thanks, Mike.
Thank you. Okay, Deborah.
Good evening, everyone. I'm Deborah Spitalnik, and on behalf of the Boggs Center, I want to say how pleased I am to be with you this evening and with our colleagues from the Developmental Disabilities Network in New Jersey that's funded through the Federal Administration on Intellectual and Developmental Disabilities. Next, please. Part of the Department of Pediatrics at Rutgers Robert Wood Johnson Medical School in New Brunswick. The Boggs Center addresses children and adults. We are New Jersey's federally designated university center for developmental disabilities, and also New Jersey's leadership, education, and neurodevelopmental and related disabilities LEN program, which is addressing autism, related disabilities, health disparities, and social determinants of health. So it feels particularly fitting that we're together on World Autism Day. The Boggs Center teaches medical students and other students, provides community training and education, technical assistance, conducts research, and provides information, all in service of fulfilling our mission of promoting the self-determination and participation of people with disabilities and building capacity. Next, please. In the interest of public health, as all of our colleagues here have done, we've been converting our program to a completely virtual and web-based program. This is a screenshot from our website, and we'll show you the address that is reachable by computer as well as phones, that shows how we have moved our trainings to web-based and virtual platforms. We've also started a new series called Just in Time, which are going to be situation-specific webinars to be developed to address the kinds of needs that we're learning about tonight and that have already been identified in the community. In addition, we've moved the Developmental Disability Series online, which I'll talk about. And also, next please, that we have collected, as our colleagues have, trustworthy resources about the coronavirus and COVID-D, including specifically those things that are designed for people with disabilities, and wherever possible, we've found resources that are available in Spanish as well as English. Next, please. Next slide, please. The Developmental Disabilities Series has converted.
Deborah, I'm not sure what happened. You dropped away.
Okay.
Oh, I think you're back.
Thanks. Sorry. I think my computer is so sensitive that even papers did it. Apologies, friends. So tomorrow, the 288th session of the DD series, a life course perspective on autism and transition to adult life, will be held virtually, and we invite you to join us. Next, as well as register for other sessions in the series. Next slide, please. We know that Medicaid is crucial for people with disabilities for both acute care healthcare and long-term services, such as the services provided by the Division of Developmental Disabilities. And we have posted for your information a plain speaking guide that describes Medicaid and how it works. Next slide, please. This is our web address. Please let us know how we can be of help and support. Let's join together as we join together in social distance. Take good care of, and thank you so much for being with us tonight.
Thank you, Deborah.
All right, good evening, everybody. My name is Paul Aronson. I'm the state's Ombudsman for individuals with intellectual or developmental disabilities and their families. It's great to be with all of you tonight. I'm so pleased. We're all pleased that so many of you could join us. I'm joined tonight by my new colleague, Christine Bachter, who is Associate Director in our office. As many of you know, for the first 2 years of this office's existence, I was sort of going it alone, but Christine has joined the team. She's had a very long first 6 weeks on the job, but she's hit the ground running, and she's been great so far, and this has been a tremendous learning experience, I'm sure, for her. As many of you know, I hope you know, our office, again, it's been around for about 2 years, and we basically serve, sort of three purposes, or we have three different roles in our office. One, really basically, we try to connect individuals and families to the services and supports that they need and deserve, so often serving as a troubleshooter, if you will. Second, we work with individuals and families to try to look for ways to improve the system, to make it more accessible, more user-friendly. And third, and very important and sort of overarching, is we work with individuals and families and try to help make sure that their voice is heard, and that it's heard in a meaningful way on issues that affect them directly, as well as the larger policy discussions. Over the last few weeks during this pandemic, we've been really focused on our role as a troubleshooter. And Christine and I have been, like a lot of folks, answering phone calls, answering emails, working 7 days. And it's really important that all of you know that we are there. We're just a phone call, an email away. Again, our contact information is there. Reach out to us any day, any night. We're there to help you, try to, help, again, connect you to the service and support you need, whether they're more general in terms of, DDE services or services provided by the Children's System of Care or Department of Education or any of the agencies, but also very, very specific to the COVID pandemic. So again, I encourage you, reach out to us any day, any night. We're here in part of this webinar, this Zoom session, more in a listening mode. Christine and I really wanted the opportunity just to hear more from you, from the questions you have, the concerns you have, and it'll help us do our job. So again, thanks for everybody for coming out and participating in this.
Thank you, Paul. All right, so that's who we are. So that gives you a quick sense of the people that are on the call right now and the roles that we have. And so what we'll do is we will take some time and start answering some questions. And so again, our thoughts were children under 21, adults over 21, what's working and what are your concerns? We have some that we can get started with as you get your fingers limbered up and start typing. Remember, there is the chat window. So you have the chat window that you can use, as well as if you are on the phone, you can email. I will check that as people were talking about their questions. All right, so as we start, how about I start with one for the group, because it's kind of, we got quite a few questions and they had common themes, if you will. And Michael, I'm going to give you your shout out right now. Michael did a great job of kind of compiling all of that into some overarching themes. And so perhaps I'll throw one or two out and then we'll go from there. So the first one I wanted to throw out was a lot of people identified there were concerns about discrimination against people with disabilities receiving all available life-saving measures. And I wonder if some people would like to discuss that.
Hi, Mike. This is Gwen. Can you hear me?
I can. Give me 1 second. I'm gonna quiet the background noise a little. Now turn your microphone back on, Gwen.
Okay, give me
There
a
you
second.
go. Yep. Oh, there you're gone.
Oh, hold on. Am I back on now?
Yeah, now you're back. There you go.
Okay, great. Thank you. So again, I'm Gwen Orlowski from Disability Rights New Jersey, and I'll just say some really preliminary things about this really critical question, and then turn it over to my colleagues who may have some stuff to add on this. So, so this is an issue, this issue of rationing of medical equipment, ventilators, PPE, so on and so forth, is of importance around the country. And in fact, in some states, policies have been brought to light that advocates and protection and advocacy organizations believe do violate the law, violate the ADA, violate Section 1557 of the Affordable Care Act, violate Section 504 of the Rehabilitation Act, and others. That they're really civil rights violations, and some states have begun filing complaints on a national level with the Federal Office of Civil Rights, and the Office of Civil Rights has taken these seriously and has issued several bulletins. The most recent one was revised, I believe, on March 28th, and maybe we could get that up on our website so people can take a look at it. Here in New Jersey, the governor has taken a different path. The governor has convened a bioethics committee to look at these issues. DRNJ is writing a letter to the governor and to that committee. It's written, it's getting its final editing done tonight after this call, and it will be sent tomorrow. And once that is finalized, we will post that on our website. Obviously urging the committee to adopt a policy that is in accordance with the law and does not ration medical equipment, ventilators, and so forth based upon somebody's status as a person with a disability.
Thank you, Gwen. Anyone else like to jump in?
Yeah, this is Deborah Spitalnik from the Boggs Center. We're also part of a nationwide project called the Center for Dignity in Healthcare for People with Disabilities. And we are reaching out to them and finding out what's also happening in other parts of the country. And we'll make that available through the people on this call and also our websites.
Wonderful. Thank you. A follow-up to your comment before, Gwen, about the bioethics committee. If there is a bioethics committee, a person with a disability must be on that. Well, I guess it's more of a statement. Sorry. I read it as a question, but yes, it's a statement. A person with a disability must be on that committee.
So, Mike, I do want to say several people have written that there's no bioethics committee. Rather, it's a professional advisory committee. Okay. I do know that I didn't watch the press conference today. It was sent to me. Unfortunately, I didn't have time to watch it. So I hear that that's what was said at the press conference today. So we'll change our letter to be reflective that it's a professional advisory committee, but our understanding is it does involve the Medical Association of New Jersey and folks who are on that. So.
Okay, excellent, thank you. There was another grouping of questions we got was revolving around Medicaid eligibility determination and a moratorium during this crisis. And I'm wondering if someone can jump on and share some information about that.
Hey, Mike. So this is Michael Brower from Disability Rights New Jersey. I can talk a little bit about that with some information that's come out. Part of the federal legislation, the two bills that have passed to, some of them have been categorized as stimulus bills. Some of what they've done is expand Medicaid compensation for states. And as part of that bill, there's a prohibition on states who would otherwise be looking to terminate an individual's Medicaid eligibility during the healthcare crisis. And that's, as declared by the president. So right now, and New Jersey's accepted that, and as far as I can tell, every other state has also accepted that increased funding because of the crisis. Medicaid terminations cannot go forward, and that is anyone who was enrolled on Medicaid as of the 18th of March and goes back to the 1st of March until the crisis is over. States cannot be terminating eligibility. So that's good news for folks. They shouldn't be worried about that particular issue. And that there's a little bit of guidance up on the CMS's website about that. If anyone wants to look up more particulars, they should feel free to go check that out. And again, we'll see if we can get some links up on our website to point to that particular resource.
That's perfect. Thank you, Michael.
Can I add to that a second?
Oh, please. Yes, go ahead.
So I just want to follow up a little bit on what Michael just said. I have heard anecdotally that some counties were terminating people if the notice to terminate went out prior to March 18th, but terminated at the end of March 31st. That has been corrected, as I understand it. A shout out to our friends at Legal Services of New Jersey. I believe they caught that problem through their advocacy, and that has now been corrected. So if somebody was still on Medicaid on March 18th, it doesn't matter if a notice went out terminating them before that for a termination date later in March. They cannot be terminated. If anybody has that issue, they can certainly call Legal Services of New Jersey for representation, and they can also call us at Disability Rights New Jersey. That's something we would handle as well.
Great, thank you. And Mercedes, you wanted to add something too?
Yeah, so for those of you who can't, or just on the phone, I did post something in the group chat. There's a resource at communicationfirst.org. It's one word together, communicationfirst.org. And there is a resource for communication rights in a toolkit, including some printable forms. One resource in particular, a health passport, that will give folks an opportunity to really capture information in the likely event that guardians and or DSPs would not be permitted in the hospital. So just want to put that out there as a resource. Thank you, Mike.
Perfect. Thanks, Mercedes. Here's a question that came in through the email. If a family does not want their Easter Seals SDEs who do not have enough PTO banked, which includes their sick leave, if they do not want them in their home due to taking precautions so as to not expose both the consumer and family to the virus, will there be some kind of provision to pay these SDEs for unworked time? Could more PTO hours be added to their current balance, for example?
Hi, Mike, it's Mercedes. So I think that question should probably go to Easter Seals as any other, in this case, employer, co-employer with the self-directed individual and family. they would need to bring that question there directly.
Excellent. Here's one of the ones that we compiled from a bunch of different questions. Can agency DSPs be paid or bill for video or telephone support of their client if they are physically distancing?
So Mike, this is Gwen. I can give a partial answer on that, or I don't know if we don't know the answer to that as I understand it yet. This is part of sort of the complexity of Medicaid. When the state wants to do things, I should emphasize that in all of my conversations with state agency partners, they want it to be very clear that the measures that they're taking are really to increase the flexibility of Medicaid, to make it easier for people who would be eligible to get onto Medicaid, to make sure that people can get the services that they need as rapidly as they need. And they're doing all of these measures to achieve that. And that a lot of that involves, some people have heard of some of these, you know, that there's 1135 waiver authority, 1115 waiver authority, a lot of numbers out there. But essentially what they mean is that the state Medicaid agency is making these proposals to the Centers for Medicare and Medicaid Services, CMS, and then the federal government has to approve it. And that's a complicated process, and some of it's already been done, and it's up on the COVID website, and some of it is in process. As I, now getting to the question, as I understand it, the DSP part of that is part of the package that doesn't have CMS approval yet, but that the state is trying to get it. So, so the state is trying to get that ability with respect to the DSPs being able to do telework with clients, and that would be an allowable service. So I hope that answered the question as best I can right now.
Yeah.
And I want to say one other thing in this, and I think we have to emphasize that we don't have perfect answers here. Everything is changing so quickly. That's a discussion, it's Thursday, that I had on Tuesday. It could have changed between Tuesday and today. So, you know, folks know that we're looking at it constantly, but this information is changing by the minute.
Yeah, thanks for saying that, Gwen. That was one of my things I was just about to say, is that we're giving answers the best we can, but who knows what's happening and what's changing. Emily had a question in the chat, which is very similar to a question we had on our list that was combined before. And it basically talks about if a person with a disability goes in the hospital, will family members be allowed to go with them and be there to support them? And what will that look like? And I wonder if anybody has some thoughts on that. To advocate for them, to make sure that their needs are met. Oh, I stumped everybody. Well, I didn't. Emily, you stumped everybody.
Sorry, this is Gwen again. I was giving other folks a chance to say some things if they wanted to. And I think that both Deborah and Mercedes have an excellent resource on that. But before I turn to them, I would say that this question has come to us at DRNJ, and we're looking into it from that legal point of view that we come from. You know, what does the law say? And in particular, focused from the position of the individual with the disability, who, by way of example, might have a communication issue and need their DSP with them in the emergency room to help with the communication. So we're looking at it from that point of view, and what those federal laws, that I've already mentioned, the ADA, Section 504, parts of the ACA, what they say about reasonable accommodations around that and what hospitals need to do. And we're trying to, we're in constant contact over different issues with the Department of Health, and we're trying to find the right person at the Department of Health to have this conversation with. So more to come on that issue from the legal point of view.
Hi, it's Mercedes back again. So I did put up the resource at communicationfirst.org, and if you can get to that, it basically will provide a toolkit explaining your communication rights, providing tips on advocating for your loved one, and they also include an accommodation request form that you can bring to the hospital. So we're looking at this as a resource that we would like you to avail yourself to in those situations. Thanks.
Thank you.
One other quick thing I want to say on this, Mike, you know, and I can see that there's somebody in the group chat who has raised this with respect to her son. I can't emphasize how critically important this issue is for us at DRNJ, and that our goal at least, is to figure out a systems change for this so that people don't have that struggle hospital by hospital, that there is a policy that hospitals have across the state of New Jersey, that they will work with families on an individual basis to allow people to accompany their loved one into the hospital, that they won't just automatically put their no visitor policies in place. Having said that, we're not there yet. We're still figuring it out. And if you individually have this issue, if it's going on in your life in real time, reach out to us because we can do individual representation on that issue, as well as trying to get a systems answer.
Excellent. Thank you. Thank you. Anybody else want to jump on that question or have anything to add? Sorry, I'm doing 7 things at once. I apologize. I did actually, I'll throw something in and give people a break for a second. I wanted to share another resource that I was reminded of today, and they sent an email into the questions link through our Assistive Technology Advocacy Center. We also partner with an organization called National Disability Institute, and they have an assistive technology loan program for people to have low interest loans to purchase or refinance assistive technology. And Lori from NDI wanted me to remind everyone, and I'll put the link to her organization in the chat when someone else starts talking, but I wanted to make sure I had that out there as we go through. Let's see, let me find another question. Wow, I thought this would be easy to do 3 screens and type at the same time, and it's not. I just realized. We talked about being in the hospital. Telemedicine we did speak about, right? Everyone? I'm saying to the people.
Hey, yeah, this is Mike. Yeah, I think we talked about it.
Yeah,
That's
okay.
still up in the air a little bit right now. So
yeah. There was a question about, does the state have a reserve of PPE available to supplement DDD providers? And I'm not sure anybody really had an answer for that, but it's a great question. And like anything else, I think it's important to remember, we don't have all the answers right now, but we can bring this stuff back and we can start gathering resources about some of this information. So.
Mike, this is Deborah. Mercedes had some new information about that. Could you share that with us, how those concerns have been brought to Senator Booker and Senator Menendez?
Yeah, as you've heard throughout the call, things are coming in all the time and pretty quickly, but we did have, I guess at a press conference earlier today, these questions were raised where group homes, supervised apartments, in-home supports for individual, that people, the DSPs providing those services need to be looked at the same way our healthcare profession is looked at for needs. And I believe they got this particular mom got the attention of our leaders. And we also had a resource, I guess it was the United Way of Bergen County, who had done some purchasing directly to bring some equipment to our folks for our DSPs, and that I don't have the contact information, but maybe we can share it on our follow-up to the people registered today to make direct contact with Tom Toronto up at the United Way of Bergen County.
Excellent. Thank you, Mercedes. Jennifer had a comment in the chat, more of a comment, not a question, about the idea of PPEs potentially interfering with communication with individuals who need to see the lips for lip reading. And as she points out, not a question, just an observation. And that is something to consider, is that thinking about those modes of communication as we go forward with some of these issues. Is there any thoughts on increasing personal preference program hours for families who need additional services and are unable to get them through other means?
Mike, so this is Michael. I could probably speak to that a little bit.
Perfect.
Gwen had kind of mentioned it. I don't think we have enough firm answers to say there is a specific way to go about this. But even in normal times, if there is a shortage of personal care time for a particular individual, that request should always go first to the managed care organization for that individual. There has been some talk of, liberalizing the process a little bit. Obviously, in-person visits are generally going to be off the table. So if there is a need, if there's a shortage for personal care time through the PPP program, that individual should definitely first and foremost reach out to their managed care organization, make the request for the additional time. I always recommend people, if you're making a request, be very, very specific in the basis for it. What's short? What kind of activities of daily living aren't getting addressed with the current allocation? The more specific, the better. And of course, this is one of the issues that DRNJ would be happy to talk to you about. If you have an individual denial for a request that you've made to your managed care organization, call through to our intake line. We can help with some of those issues, and at the bare minimum, point you in the right direction for how to go about solving them.
And Mike, this is now Gwen adding to what Michael just said. And I'm going to preface it with my disclaimer. There's a lot going on right now with the state Medicaid agency and what they're asking for and what they've already asked for from the federal government. And they're not at a point yet where they can speak 100% clearly about all of that, because they have to wait on some of those authorities. So, but with respect to the PPP program which is the personal preference program, is rooted in personal care assistant hours, PCA hours. And there is something I think I can say on that, that is part of the authority that was already granted. So I hope I'm not speaking out of turn. So with PCA hours, first of all, people can request PCA hours still and can request additional PCA hours, as Michael just said, through their managed care. And I believe those now are all being tele-assessments. So they're not going in person, but they're doing a screen for those over the telephone. And to the extent that somebody needs more services because of a COVID reason in the house, there's some COVID specific problem. Somebody in the house is in quarantine, for example, a family member who was providing some of the hours of service, right? So maybe you had a provider agency coming in, or you had PPP hours self-directed, but there was somebody else who was giving informal unpaid hours, and that person no longer can because of COVID. As I understand it, the MCOs right now are supposed to process those requests within 24 hours. So there should be more responsiveness on that. I will note one issue that is problematic, but I know that the Medicaid agency is seeking clarity on it. With respect to the ability to appeal those decisions and fair hearings, they've been given some latitude on timeframes from CMS, mostly to the benefit, the purpose is to the benefit of the member and the beneficiary. However, the Office of Administrative Law has been closed. I heard today that it opened up for special education mediations and due process, but I have not heard that it is open yet for Medicaid appeals. And so to the extent you ask for these things and they're not granted, people's fair hearing and due process rights right now are a little bit limited until that's all figured out.
Excellent. Melanie asks, is there training to educate people how to properly use PPEs? I don't know the answer to that.
I didn't hear the question. Can you?
Is there any training? Oh, wait, I got to scroll back to it. Sorry. Is there training to educate people how to properly use PPE?
That's not a question I would know the answer
Yeah,
to.
I don't know. I don't know. I'd go to the CDC website. Maybe that's where I send everybody else that asks me a question. Let's see what else we have.
So Mike, can I just address one that I'm seeing right now about the ASL English interpreting staying on the screen in the chat box?
Sure.
So I just want everybody to know we're aware of that, and Deborah's been a real champion of that issue. And we've looked at it, and we have staff who are deaf and have watched those, and they're seeing that that between the ASL interpreter and the closed captioning, that they were finding that there was interpretation for the entire address. However, given that somebody's raising it again, we'll go back and look at it again. We were on the cusp of sending a letter to the governor, and then we backed off, but we can look at that issue again.
This is Deborah about this issue. It depends on what platform or media you're viewing the governor's press conferences.
Mm-hmm.
His YouTube channel, you can see it. On some of the New Jersey television, you can't. So I think there is further work to be done, but it depends on the platform.
Thank you, Deborah. I see people commenting in the box, why isn't DDD leadership on the call? And I feel like we can't answer for people that are in the DDD leadership. That's just my own thought. I don't know.
Mike, this is Deborah. I think that we should be clear about the purpose of this call, which is not that people who are working state government were not willing to participate or not interested in participating. This convening a town hall was an idea that came forward from the 3 programs that are federally funded under the DD Act: the Disability Rights, the Jersey Council on Disabilities, and the Boggs Center, as you said, in conversations with our colleagues in the Ombudsman office. So this was never meant as an informational briefing, but rather as a listening session. And I think I just think that we want to make sure that this in no way reflects on our colleagues in state government who are working around the clock. I think it raises the question, is this useful for people, and to let us know if this is meeting needs or if there are other kinds of forums that would be more helpful. But the purpose of this was really to convene a listening session and make it clear that even though we're physically separated, we are a community that's deeply connected to each other and wants to be of service and support in any way we can.
Yeah, and with that said, I know, Paul, you wanted to add something as we got near the end, so I'll give you a chance to add that.
Sure. Thanks, Mike. Just a couple things, and I'll just pick up on what Deborah had said. This was the brainchild of the 3 organizations, the DD partner organizations. The Ombudsman office works very closely with them, and so they allowed us to sort of be a partner in this endeavor. And again, this is really an opportunity to sort of flesh out some of the questions and concerns. And what we're planning to do is to make both the chat dialogue as well as the video available to our colleagues in government. And so they can learn from this experience too. And, hopefully this is not the last time we'll do this. Hopefully we'll continue to do this. And that might be something that Mike might be talking about in a minute. I also just wanted to point out, in terms of the role that we've been playing in the Ombudsman office over the last several weeks, really, again, trying to sort of connect people and make sure people's voices are heard. And what we've been doing, multiple things, but one of the things we've been doing is keeping a daily list of the issues and questions that are raised to our office and sharing that with DDD leadership, with the leadership of the Children's System of Care, with the folks in the Department of Education who work in special education, as well as the health commissioner and colleagues in the front office, the policy chief in the governor's office, chief of staff, the deputy. So we're trying to share this information. And so it's really important, your participation tonight, as well as the phone calls and the emails that we all been getting are extremely important to make sure that your voice is heard, and we are sharing that up, and we're hoping that it turns into some actionable items. So I hope everybody did see this as worthwhile, and that we can continue, because I think just the more conversation, the more lessons learned, good, bad, or otherwise, I think it will benefit everybody. Thank you.
Thank you, Paul. I appreciate that. Yeah, and with that said, I'm going to call that our final thought, Paul. I'm going to let you have that final thought. And just to reiterate what Paul had said, we will take the chat and share it back out. We'll take names out of it, obviously, and just have the chat information there. But I think this is the start of something. And I think, as Gwen said, things change daily, at least 10 times throughout the day. So I think the more we know and the more we hear from people in the community, we can figure out how to move forward and meet those needs. And hopefully this worked on some level for you. We will leave that email address open. So it's questions@drnj.org. You can continue to put questions there, and we will provide feedback to you, and we will take those and compile them and share them with our partners, and do our best to share as many resources as we have as we go forward. Perhaps we'll do some more of these. As a group, we're going to discuss that and determine when that schedule is put together, what it looks like, how often this happens, what's the best format for this. So if you have thoughts of how this went, you can also use that questions email to share those thoughts. We'd love to hear some feedback. As a first one, it's always nice to get a sense from the community of what worked, what didn't work, and how we should do it differently. So we do thank you for your time tonight. Hopefully that was valuable to you. We will post this up in a couple places, actually. As you see, we have a handful of agencies represented here. I know immediately we'll take this recording of this conversation tonight and post it up on the YouTube channel for the ATAC, which is the project that I'm the director of. So if you go to YouTube and search ATAC NJ, it'll be posted up there probably by the morning. It'll be up there and available. And then I will share this video and audio with all of the partners that are on the call, and we'll make sure that it is provided to you on their channels as well. So again, thank you to everybody. Thank you to the panel members who participated. Appreciate it. It was a fast hour, and I think that's great. Thank you for all your time tonight. And I hope that we see you on a future session. Thanks very much. Have a good night.